Let's cross now to Beijing to speak with our correspondent there, Charles Pellegrin. Charles, what assurances are there that this team will have the access they need to carry out their investigations?
Well, China has promised full cooperation and openness to the WHO ahead of this mission, and the WHO investigators currently in China intend on discussing this pandemic with their Chinese counterparts in the Chinese scientific community. They also want to see, while they're here, if there's any unexamined samples of previously unexplained respiratory diseases that can still be found, and they obviously want to better understand the ways in which the virus could have jumped over the species barrier to human beings. The question here is, are they actually going to be able to do this? I mean, China has a history of pressuring people into repeating and saying the party line. This is something, as a journalist in China, that you see often. It's rare to hear dissenting voices out in public. And then there's a question of how likely it is that they'll find anything a year after the initial outbreak. If we take the example of Wuhan seafood market, which is considered to be the epicenter of the pandemic, well, it was completely closed over a year ago, and has been entirely disinfected as well. The WHO team is here at China's invitation, and they know very well that China is pushing forward that this is a sensitive topic in China, and that China is pushing forward this idea that the virus didn't originate within China, that this is only the place where it was first detected. So that's why the WHO team has been at pains to explain that this is not going to be a finger-pointing exercise directed at China. This is just a mission to better understand the virus.
Now, the arrival of that investigating team comes as China reports its first COVID-19 death in 8 months. What should we be reading into that, do you think, Charles?
Well, judging from this statistic, the first death in 8 months, and from the fact that there's at least 24 people who are in a severe condition, this is clearly like the biggest challenge that China has had to face in terms of COVID in several months, in a while. And this is also a particular concern because of the proximity of this latest outbreak in Hebei with Beijing. Shijiazhuang, the capital of Hebei, where there's quite a few cases, is around 250 kilometers away from Beijing. Also of concern is the fact that less than a month away is the start of the Lunar New Year festivities, when Chinese people are meant to travel around the country to visit their families. So this is why the authorities are discouraging non-essential travel ahead of this period. This is also why over 20 million people are currently in a state of lockdown in eastern and northeastern China. There are two main sort of lessons that have been learned from this latest outbreak by the authorities. First off, it seems as though rural areas were overlooked in the screening and in general in the anti-epidemic prevention efforts, and that actually testing capacity in rural areas isn't as strong as in big cities. And the other lesson that was learned is the role played by asymptomatic carriers. The experts here seem to be saying that this latest outbreak in Hebei could have started as early as early November, and that it was sort of going around undetected for a while until the first cases a few weeks ago. So really we'll see how the situation evolves over the next few days, whether China's response has been timely, and whether we'll see a plateau in the number of daily cases, or whether they'll keep ballooning or not.
Charles Pellegrin in Beijing, thank you very much.